Today we're going to take a further look into mental illness. Previously, we stated that a mental illness is a disorder that impairs a person's capacity to function normally and safely. A functional mental disorder is a disorder that occurs as a result of psychological causes or trauma in which no brain damage is involved. When we look at anxiety, we defined it as a disorder in which real or imagined fears prevent a person from enjoying life. Now, anxiety has a lot to do with stress, and a normal reaction to stress can actually be beneficial in some situations for most individuals. However, for others, it becomes excessive, and these individuals realize that their anxiety is becoming too much for them, but they have a difficulty controlling it or learning how to cope with it. The exact cause of anxiety is not known, but it does result from a combination of genetic, psychological, and developmental factors. When we think about the symptoms of anxiety, it needs to last at least 6 months for it to be classified as this disorder, and it's going to cluster around excessive irrational fear and dread. Over 40 million American adults ages 18 plus are affected by anxiety in any given year. Women are 60% more likely than men to be affected by anxiety, and 8% of teens ranging from the ages of 13 to 18 do have anxiety. The treatment for anxiety includes psychotherapy or medication, or a combination of both. It's really what works best for you, but the only way to know if you do have anxiety is to seek professional help. Obsessive compulsive disorder, on the other hand, we break it down into two parts. The obsessive side is persistent thoughts, ideas, or voices that causes a great deal of anxiety. The compulsive side is the urgent, repeated behaviors that, when done, will give you a brief relief from that anxiety. Individuals feel the need to check things repeatedly or have certain thoughts or perform routines and rituals over and over. Doctors believe that sometimes OCD will run in families, but no one knows for sure why some people have it while others don't. Symptoms are repeated thoughts or images about many different things. They do same rituals over and over, and they can't control their unwanted thoughts or behaviors. OCD affects 2.2 million American adults. It strikes men and women equally and appears in childhood, adolescence, or earlier adulthood. You usually won't see this in individuals 40 plus. Treatment is psychotherapy, or known as cognitive behavior therapy, medication, or a combination of both. Taking a look at anorexia. Anorexia is a disorder in which individuals refrain from eating to lose weight. These individuals have abnormally low body weight, they have an intense fear of gaining weight, and a distorted perception of body weight. It's usually caused by a complex interaction of genetic, biological, behavioral, psychological, and social factors. These individuals see themselves as overweight. There's an extreme thinness to them, an intense fear of gaining weight, distorted body image, and extremely restricted eating. When these individuals restrict their eating, they're not nourishing their bodies in the proper ways, and they're going to look very frail and even pale. The ends of their hairs will be very brittle, nails will chip easily. They just do not have the proper nutrition to live a healthy lifestyle. Individuals who are affected by anorexia, it usually appears during teen years or young adulthood. It affects men and women equally, but more so women are diagnosed. The treatment for anorexia is restoring a person to a healthy weight. We have to treat the psychological issues and reduce or eliminate behaviors that led to insufficient eating. On the flip side, we take a look at bulimia. Bulimia is a cycle of binging and behaviors such as self-induced vomiting to undo the effects of binge eating. The same as anorexia, bulimia is caused by a complex interaction of genetic, biological, behavioral, psychological, and social factors. Now, with the symptoms of bulimia, you're going to notice the same symptoms that you do in anorexia, but individuals with bulimia are more so going to have dark circles under their eyes. They may have yellowing of the teeth. That's because the enamel being eroded by the acid of the vomit. They're going to have a lot of stomach problems and just are going to be weak in their demeanor. Same as anorexia, it appears during the teen years or young adulthood. It does affect men just as much as women equally, but it's more so diagnosed in women. Treatment, again, is psychotherapy, nutritional counseling, or medications. When we take a look at PTSD, We're looking at an individual who feels stressed or frightened even when they're no longer in danger. Causes are possible genes that play a role in creating fear memories and brain areas that are involved in dealing with fear and stress. Chemicals not being released to help control the fear response. So there's many causes to PTSD, but it is caused from a traumatic event and the way that the brain reacts to that. Symptoms. We classify symptoms into 3 categories. The first category is re-experiencing. That's going to be flashbacks, bad dreams, or frightening thoughts. Our second category is avoidance. Individuals are going to feel emotionally numb, a strong guilt, or they may even have trouble remembering the event. And then the last category is hyperarousal. They're easily started, they're tense or on edge, and they have difficulty sleeping. PTSD can occur at any age, but women are more likely than men, and the susceptibility may run in families. Treatment, again, like all the other disorders, are psychotherapy, cognitive restructuring, or stress inoculation training. Schizophrenia. Schizophrenia is chronic, severe, and disabling brain disorder. It's characterized by impairments in the perception or expression of reality and by significant social or occupational dysfunction. A person experiencing untreated schizophrenia is typically characterized as demonstrating disorganized thinking and as experiencing delusions or auditory hallucinations. The causes of schizophrenia are likely to be genes and environment. They have a different brain chemistry and structure that causes them to experience these symptoms. Symptoms include hallucinations, delusions, thought disorders, movement disorders, lack of pleasure in everyday life, and a trouble focusing or paying attention. Only about 1% of Americans have this illness, and it affects men and women equally. Treatments include antipsychotics, psychosocial treatment, and cognitive behavioral therapy. Bipolar disorder is a brain disorder that causes unusual shifts in mood, energy, activity levels, and the ability to carry out day-to-day tasks. Causes for this, again, are genetics and brain structure and functioning. When we look at the symptoms of bipolar disorder, we have to split it into 2 categories. First, we take the manic. The manic is long periods of feeling high and extreme irritability. Then we take the depressive side of bipolar, and that's long periods of feeling sadness or loss of interest in activities that were once enjoyed. Often a person develops bipolar disorder in their late teens or early adulthood. At least 1/2 of all bipolar disorder cases start before the age of 25. Medication, mood stabilizer, antidepressants, and psychotherapies are all different treatments for this disease.